Hi, I'm Dr. Shari Caplan. I'm board certified in anti-aging and regenerative medicine. I just finished my fellowship in the same, and it includes functional medicine. I have a holistic approach to wellness. I use conventional along with complementary medicine. Programs I offer are pregnancy optimization, infertility, hormone balance, and wellness. I got connected with A4M and started doing conferences on bioidentical hormones. And originally that was my goal, was to learn more about bioidenticals, find out their safety, and there are huge differences between conventional hormones and bioidentical, that replacing what you previously had logically makes much more sense than giving a foreign substance that our body doesn't have the enzymes to break down. And there's many different reasons why the synthetic hormones may not do a good job at symptom control, but actually may increase your risk of cancers. So, that sort of started my journey, but as I started learning, I learned much more about wellness or optimizing people's health, and it was really about lifestyle and exercise and the way we eat and taking supplements and avoiding nutrient deficiencies. And let's look at how do I prevent all these things from happening, prevent diabetes, prevent cancers, prevent cognitive decline. Then I think that's a great route, and I think a lot of my patients kind of feel in the same way. I'd rather sort of deal with something preemptively than wait for a problem, and then it's really hard to sort of treat. So with regard to my approach to a patient, I have a very holistic approach that I will use conventional investigations, but as well use some functional tests. And we do micronutrient testing, and I can say to you, you actually have a deficiency in all these things, and these things can lead to disease or illness or not appropriate function. Then by replacing them, I'm not going to do any harm. If anything, I'm going to improve your health. With regard to fertility, there are a lot of nutrients that if you're deficient in, that your fertility is going to be reduced, sperm counts are going to be decreased. And so if at least I can sort of do those things, then we can, optimize your health. With regard to iodine, iodine is a very important nutrient, and if a woman is deficient in her pregnancy, she's more likely to have thyroid issues, and that has effects on babies and their cognitive functions. There's testing that we can do in terms of looking at cholesterol in a very different light. There's two types of HDLs and LDLs that have different risk factors, and homocysteine is a very important marker to look at, not only for heart disease and cognitive decline, but even in pregnancy, that if it's elevated, there's higher risk of miscarriage, malformations, and so there are certain supplements that we can use to help improve homocysteine levels, which may and then improve outcomes. If you're interested in coming to see me and optimizing your fertility or your health, please go to my website. All my contact information is there, and I'm looking forward to seeing you.